The thing is, some things are too important for us to postpone, and this is one of them. The dignity, the safety, the mental well-being of our female doctors, that's not something कि हम उसको postpone कर पाएं. What happened on June 5, 2026 was that Dr. Mahnoor Nasir thi, and she was a trainee in Civil Hospital, Quetta. She suffered severe acid burns in a targeted acid attack, or fortunately, the attacker, he was killed there and then, basically. But what about the impact that he left on Dr. Mahnoor? Because she suffered, right? She suffered physically, and after that, she suffered psychologically. She must be feeling embarrassed. Think what all must be going on in her mind right now. और इसमें बहुत सारी चीजें होती हैं. We as medical students, we should not consider this incident a far off news. We have our responsibilities. What can we do? How can we spread awareness about this? How can we protect ourselves? How can we support those people who are affected? How can we support them physically, emotionally, psychologically, and legally as well? And to address all of these questions, we are here today, students of Khyber Medical College from two societies, SWS and IFMSA. Our session will be divided into three parts, as I said initially. First of all, the speakers of IFMSA SCOME team, they will be speaking on the acid attack first aid, and they will also speak about preventing such attacks. वो जो एक लफ्ज़ है situational awareness वाला, how to like be safe in the first place. This is what they'll be speaking about. Then we have Advocate Ahsan Khan. There will be a legal segment, Know Your Rights segment, and he'll be speaking about that. Thank you for being here, sir. And then we have Dr. Saqib Naseer, and he will be talking about the counseling and rehabilitation for those people who are affected by such events. Now, before I proceed, my co-host Hamdan, he will be hosting this event. So they say that credit must be given where it is due. So I'd like to mention my assistant director Salga and my co-team member Hamdan. They both worked very hard for making this happen. Thank you very much. And obviously the IFMSA team worked as well. Sir Saqib, Advocate Ahsan. So without any further ado, I'll just hand over the mic to Hamdan. Hamdan, the stage is yours.
Assalamu alaikum. Am I audible?
Yes,
yes, sir, you are audible.
Thanks, Khalid bhai. As Khalid bhai mentioned, I am a core-team member of the SWS Society Patient Care Wing of Khyber Medical College. And without further ado, I'll be introducing our first speaker. We have Hasnan representing SCOME, the Standing Committee on Medical Education. That's basically one of the 6 standing committees of IFMSA, the International Federation of Medical Students Association. Hasnan will be addressing a critically important topic, acid attack first aid. Now, he will also be covering how to stay safe, stay calm, avoid conflict, and sensitively manage both patients and attendees. So, Hasnan, can you please unmute your mic and share your screen? He's not here, so we can continue with Dr. Saqib, and Hasnan's segment will be readjusted. Dr. Saqib, for a brief introduction, he holds an FCPS in psychiatry, a diploma in cognitive behavioral therapy, and a certificate in child and adolescent mental health. He also holds a certificate in health professionals education from Khyber Medical University, reflecting his commitment to excellence in medical teaching. Not only that, Dr. Saqib is an active member of the International Society of Substance Use Professionals, engaging with global initiatives in addiction prevention and mental health. Dr. Saqib.
Thank you for inviting me to this utmost important topic. I would like to thank Ali, Hamdan, Hasnan, and Salka for choosing this topic and to talk about it in a variety of ways in the context that we are living today. So I'm Dr. Saqib Naseer. I'm working as an experiential registrar in the psychiatry department at Khyber Teaching Hospital. So I would like to talk about the psychological impact of workplace violence and harassment against women in healthcare. So first of all, what are the objective of this presentation in the today webinar is, first of all, we have to define what is workplace violence and harassment. If we got the definition correct, then we know about the outcome, the common forms, each and everything that is attached with the violence and harassment. So how the workplace harassment against women is done, what are the common forms, how trauma is recognized in affected health workers. The recent attacks, as Ali mentioned, the Dr. Mahnoor case from Quetta, from harassment to trauma, the recent attack, we will also briefly discuss that and shed some light on the recent events that have been happening of acid attacks in Pakistan. So what are the psychological impact? What are the immediate and long-term consequences? And what will be the key findings, and what are the healthy coping strategies for female healthcare workers exposed to workplace violence and harassment? So by definition, as two bodies have defined this, one is International Council of Nurses and other is WHO. So it's defined as incidents where staff are abused, threatened, or assaulted in circumstances related to their work, including communicating to and from work involving an explicit or implicit challenge to their safety, well-being, or health. So if you do have any question, you can raise your hand. I will answer accordingly to each and every query that you have. So what is workplace harassment against women? The WHO...
Sorry to interrupt you, sir.
Mhm.
Questions के लिए sir आखिर में एक segment हमने रखा हुआ है, and anyone who has any questions can ask them. You can
Okay.
continue your presentation uninterrupted.
ठीक है. Just मैंने इससे ऐड किया कि अगर फिर भी किसी का कोई क्वेरी
सही
रह
है,
जाती
सही
है, तो समझ नहीं आती,
सही है. They can type it in the chat box and we'll have a segment at the end.
ओके. सो WHO ने इसको फर्दर डिस्क्रिप्शन इसकी की है वर्कप्लेस हैरेसमेंट की. उसमें वर्बल, नॉन वर्बल, फिजिकल, साइकोलॉजिकल और सेक्सुअल बिहेवियर्स जो औरतों की डिग्निटी, सेफ्टी, वेलबींग और प्रोफेशनल एडवांसमेंट जो उनके वर्कप्लेस में है, उनको इफेक्ट करती है, दैट इज कॉल्ड हैरेसमेंट. So why women are particularly vulnerable in the context that we are discussing today? एक तो हमारे मुआशरे में जेंडर पावर डायनामिक्स बहुत ज़्यादा है, हायरार्किकल स्ट्रक्चर्स हैं, डिपेंडेंस ऑन सुपरवाइजर्स फॉर ट्रेनिंग इन करियर प्रोग्रेशन. It's not just about the supervisor. If you're studying in the medical college, you will see a lot of professors that are abusing their powers. So we will come back to that, but for now, it's to supervisor for training in career progression. The other is social stigma. The social stigma is basically the fear of blame, fear of not being believed, fear of professional repercussions, which happens a lot in our universities and in our culture specifically. And then there's the cumulative stress burden. So there could be workplace stress, family responsibilities, societal expectations are there, and the psychological impact often extends beyond the workplace into family relationship. So the topic we are discussing, that will come in the later slides, why the family relationships are affected because of it. The sleep, the self-esteem, and overall quality of life is affected by the harassment and the violence that occurs against women. So what are the common forms? Can anybody, apart from that they are seeing on the screen, identify the common forms? I want it to be interactive, so that's why I'm asking that question. That you have seen in your medical college, basically. Anyone can say it. It's not a judgmental presentation. So anybody can say what they have seen, what they have experienced, or what they have seen or witnessed is a second account. So the common forms are that are very meticulously made in our society is that we tend to do sexual jokes, comments or gestures, unwanted touching or physical contact. A lot of cases are coming on the news nowadays about the gestures and all of that, but repeated requests for dates or personal relationships, you will see a lot of DMs and people getting to through social media, and there is obviously a gender-based discrimination in our society. Bullying, intimidation, humiliation, messages of social media, and retaliation after reporting misconduct, which is a very common practice, unfortunately, that we see. So if we are discussing the common forms and then how to recognize the trauma in female health care workers. So first of all, there are emotional signs. There will be fear, and anxiety, irritability. Irritability is something a lot of people basically confuse it with anger, but anger and irritability are two different things. Irritability is a decreased threshold for anger, and anger is a different emotion altogether. Emotional numbness, shame and guilt, they tend not to share those things with a lot of their friends and colleagues or family members. Loss of confidence, obviously, and there are cognitive signs, difficulty concentrating. Obviously, after that trauma, how can a person concentrate? And intrusive memories, hypervigilance. He's always guarded about it, and he's always in a flight and fight mood. And negative self-beliefs, distrust of colleagues and supervisors also comes along the way. So the scientists continue towards the behavioral science. Absenteeism is one of the most common signs that you will see. Departments, avoidance of specific departments or individual that are basically the abusers or the person is there in the department. So there is social withdrawal, you reduce work engagement, and increased substance use. That is not particularly for women, but also the men that has been abused through different authorities. Physical signs that you will see will be sleep disturbances, fatigue, headaches in different forms, obviously gastric headache, tension headache, gastrointestinal complaints, a lot of GI patients that comes to OPDs or emergency are with some sort of anxiety, panic, or depressive symptoms. Palpitation in somatic symptoms are very common. So what are the red flags that we will discuss requiring mental health referral? If you see a patient, if you see your colleague in obvious distress, that you want to reach that person and have a discussion with him to seek professional help in that regard. So persistent PTSD symptom, PTSD is hyperactivity, impulsivity, irritability, and intrusive thoughts. The combination of these is PTSD. Major depressive symptoms, which is again low mood, loss of energy, lack of interest in daily activities, that's in anhedonia. Panic attacks, self-harm or suicidal ideation is very common in those patients, and significant occupational impairment. So those people wouldn't be able to perform their daily activities that they are assigned. So there is a saying, there was a quote by Dr. Geber, trauma is not what happens to you, it's what happens inside you is a result of what happened to you. I hope everyone have understood this quote by Dr. Geber. So coming back to the topic that is obviously related to the context, that is from harassment to trauma, the case of Dr. Mahnoor. So as you all know, Dr. Mahnoor Naseer, a young female doctor, was working in Quetta and she suffered an acid attack while on duty, triggering nationwide concern among healthcare professionals regarding workplace safety. So it's not the first time, it's been happening for a very long time, but we tend to ignore it. It was brought to the media because of the today's fast-paced media and all of the social platforms that are available today. Back in the day, when you go towards early 2000, there were no social platforms, no media available, digital media specifically. So those cases were underreported, and still today, in urban areas, the cases are reported. In rural areas, the cases are not reported, such as honor killing is not reported, same as the this case. So what are the common motivation if somebody is committing a heinous crime like that? So the motivation should be of that intensity. Either he's suffering from psychopathy, sociopathy, or other that are commonly presented in our to sensationalize the news of those attacks, which was basically brought in through the Dr. Mahnoor case also, which is unfortunate, by the way. And it deeply saddened me when the media present the case as a form of that, basically is a rejection. Refusing marriage, for example, engagement or sexual advances. There should be motivation, और commonly जो motivation हमें मिलती हैं, जो हमने पढ़ी हैं, domestic disputes हैं, जिसमें interfamily conflicts होते हैं, डाइवोर्स रिक्वेस्ट भी हो सकते हैं, फाइनेंशियल डिस्प्यूट्स हो सकते हैं जिसमें डॉरी के केसेस हैं. इफ यू सी आवर society, specifically the rural areas, if you study the India, our neighboring country, so dowry demands पे लोगों को जलाया जाता है वहाँ पे, यहाँ भी जलाया जाता है, ऐसा नहीं कि यहाँ पे नहीं जलाया जाता. एंड प्रॉपर्टी फाइट्स जो होती हैं उसमें भी बहुत से केसेस इस तरह आपको खुल के सामने आते हैं. तो स्कोप ऑफ द प्रॉब्लम क्या है, ये प्रॉब्लम कितनी बड़ी है, कब से हो रही है? सो जो अभी तक स्टडी हुई है उसमें इंटरनेशनल डिसफिगरमेंट टारगेटिंग, जो जिस तरह मैंने कहा शुरू में, इट्स अ जेंडर बेस्ड क्राइम. सो बेसिकली वुमेन ही इसमें प्रेडोमिनेंटली टारगेट होती है. 80% ऑफ द वुमेन, एज फार एज आई नो, एज फार एज आई हैव स्टडी. सो एनुअली जो केसेस होते हैं दैट इज 150, एंड डिफरेंट एडवोकेसी डिफरेंट फिगर्स को कोट करते हैं, बट 150 to 200 केसेस एनुअली हमारे यहाँ होते हैं. जो डॉक्यूमेंटेड केसेस हैं 9,300 डॉक्यूमेंटेड केसेस हैं बिटवीन 1994 एंड 2018. बट अकॉर्डिंग टू एसेट सर्वाइवर फाउंडेशन, जिनकी 24 ईयर की हिस्ट्री है इस केसेस को ट्रैक करने में, जिन्होंने 1999 से लेकर 2022 तक स्टडीज की हैं, तो उनके अकॉर्डिंगली 3,873 केसेस अभी तक डॉक्यूमेंटेड हैं. सो अर्बन केसेस अभी डिक्रीज हो रहे हैं, लेकिन रूरल केसेस उसी तरह असिस्ट करें, क्योंकि वहाँ पे एसेट का एक्सेस बहुत कॉमन है और बहुत ईजिली मिल भी जाता है. सो if the asset attack happens, what are the physical consequences? So obviously it's a concentrated material. It will hit you where it hurt the most: the face, the neck, upper body. Permanent blindness, hearing loss. You might have seen the pictures of Dr. Mahnoor, other asset attack survivors. So there's deep tissue damage, painful skin contractures, and requires a lifetime of expensive reconstructive surgeries. So they lose the hell on them, basically, whoever does the heinous crime. I won't say they are human, but if they are human, they are basically the psychopathic part is more relatable to them. So what are the psychological impact? Immediate effects में आप देख सकते हैं, इमोशनल रिएक्शन हो सकते हैं, फेयर का हो सकता है, एंगर का हो सकता है, शेम का हो सकता है, हेल्पलेसनेस हो सकती है, ह्यूमिलिएशन हो सकती है. कॉग्निटिव इफेक्ट्स एज वी डिस्कस वही हैं जो पहले थे, एंड अवॉइडेंस बिहेवियर हो जाती है. ऑब्वियसली कोई फीमेल, इट्स अ कॉमन इमोशन, इट्स नॉट अ जेंडर बेस्ड ओपिनियन, इट्स अ कॉमन इमोशन. कोई भी अगर मेल भी एसिड अटैक सर्वाइवर है, उसका फेस डिसफिगर हुआ है, तो ऑब्वियसली वो वहाँ जाना पसंद नहीं करेगा. सो इंक्रीज एब्सेंटिज्म है, सोशल विड्रॉल. सो अगर मेल के साथ भी हो जाए तो वो यही बिहेवियर इफेक्ट्स के साथ आएगा, यही कॉग्निटिव और साइकोलॉजिकल इफेक्ट्स के साथ आएगा. इम्पैक्ट लॉन्ग टर्म कॉन्सिक्वेंसेस क्या हो सकती हैं? एंजाइटी होती है, डिप्रेशन होता है, पोस्ट ट्रॉमेटिक स्ट्रेस डिसऑर्डर होता है, सुसाइड, सेल्फ हार्म होता है, और बर्नआउट सिंड्रोम्स होते हैं. प्रोफेशनल फंक्शनिंग पे क्या आपकी इम्पैक्ट हो सकता है? दैट इज फॉर हेल्थ केयर वर्कर्स, जॉब सेटिस्फेक्शन रिड्यूस हो जाती है, मोरल उसका रिड्यूस हो जाता है, टर्नओवर जो इंटेंशंस उनसे होते हैं नॉर्मली वो इंक्रीज हो जाते हैं, और कैरियर अबंडमेंट. बहुत से लोग कैरियर को खैर बात कहते हैं, क्योंकि उस जगह पे जाना उनके लिए जहन्नम से गुजरने के बराबर होता है. तो पेशेंट, देयर इज अ रिड्यूस्ड क्वालिटी ऑफ केयर, इंक्रीज रिस्क ऑफ एरर्स, इम्पेयर्ड थेरेप्यूटिक, क्योंकि अगर डॉक्टर सफर कर रहा है या हेल्थ केयर वर्कर, सो पेशेंट भी सफर करेंगे ऑब्वियसली. इम्पेयर्ड थेरेप्यूटिक रिलेशनशिप्स हो सकती हैं उसकी वजह से, वर्कफोर्स रिटेंशन डिक्रीज हो सकता है, और साइकोलॉजिकली अनसेफ वर्कफोर्स अल्टीमेटली कंप्रोमाइजेस द पेशेंट सेफ्टी. सो की फाइंडिंग्स जो रिसर्चेस आज तक हुई हैं उनमें क्रॉस सेक्शनल स्टडी जो फीमेल हेल्थ केयर वर्कर्स हैं जो टर्शियरी केयर हॉस्पिटल्स में काम करती हैं, उसमें जिस स्टडी का रेफरेंस मैंने दिया हुआ है, दैट इज द जर्नल ऑफ पाकिस्तान मेडिकल एसोसिएशन, एंड स्टडी बाय कुरतलैन, मोहम्मद इब्राहिम एंड फजल et al. 72.9% experience verbal violence, 18.6% experience physical violence, 23.6% experience verbal sexual harassment, and 9.3% experience physical sexual harassment. So अब आते हैं हेल्थी कोपिंग स्ट्रेटजीज फॉर फीमेल हेल्थ वर्कर्स की क्या हो सकती हैं जो कि वर्क प्लेस वायलेंस या हैरेसमेंट के शिकार होते हैं. सो इंडिविजुअल लेवल पे आप देख सकते हैं कि वो सीख कर सकते हैं सोशल सपोर्ट. सो वो से सोशल सपोर्ट से बेसिकली ट्रस्टेड कोलीग्स, फ्रेंड्स और फैमिली मेंबर्स हो सकते हैं. पीयर ग्रुप्स में वो पार्टिसिपेट कर सकते हैं और अवॉइड करें आइसोलेशन. एंड देन देयर इज अ प्रोफेशनल मेंटल हेल्थ सपोर्ट. सो अर्ली साइकोलॉजिकल असेसमेंट इन सिम्पटम परसिस्ट, काउंसलिंग और साइकोथेरेपी, फॉर एग्जांपल सीबीटी है, ट्रॉमा फोकस थेरेपीज हैं, या साइकियाट्रिक जो कंसल्टेशन है जब भी इंडिकेटेड हो. स्ट्रेस मैनेजमेंट टेक्निक्स हैं जिसमें माइंडफुलनेस टेक्निक्स है, डीप ब्रीदिंग एक्सरसाइजेस हैं, पीएमआर है, प्रोग्रेसिव मसल रिलैक्सेशन एंड मेडिटेशन. मेंटेनिंग फिजिकल वेल-बीइंग, ऑब्वियसली रेगुलर एक्सरसाइज, एडिक्वेट स्लीप, बैलेंस न्यूट्रिशन, और जो हमने अभी डिस्कस किया था कि माल एडेप्टिव कोपिंग स्ट्रेटजीज में ड्रग्स आती हैं, तो लिमिटिंग अल्कोहल अगर और कोई इस तरह के माल एडेप्टिव behaviors हैं that should be discouraged. So how will you establish boundaries basically individual level पे? Unacceptable behavior को आपने recognize करना है, harassment report करनी है through appropriate channel, assertive communication skills आपने learn करने, workplace level strategies आपने बनानी है. अगर आपके साथ कोई भी इस तरह वाक़या होता है, make sure that your peer, your confident knows about your friend, family members, anybody that is your confident should know about it. Mentorship and supervisory support, access to employee assistance program, safe reporting mechanism होना चाहिए, and trauma informed workplace culture होना चाहिए, क्योंकि अमूमन जब trauma informed workplace culture नहीं होता है तो वो लोग तन्हाई में जीते हैं, वो तन्हाई में वो सफ़र करते रहते हैं हमेशा. So as a psychiatrist, I would like to end the presentation with a particular strong concluding statement. So when female health workers begin to fear their workplace, the consequences extend beyond individual suffering. They affect professional and performance, workforce retention, and ultimately the patient care. So thank you for listening, and that's all from my side. Now I'd like to listen to our advocate friend, Ahsan. So yeah, he can talk about more about the laws, legislation about the asset procurement, and what acts are basically withdrawn towards the asset attacks. Thank you.
Thanks a lot, Dr. Saqib. We have a short session before the advocate takes over, but thanks for giving us a clear understanding of the psychological impact acid attacks have on victims. Because this is a dimension of this issue that is just important as the physical one. So we're grateful to have people like you. Once again, thanks, Dr. Saqib. So for the next speaking session, we'll be calling Hasnan again. And Hasnan, I've already introduced you. I hope you don't mind. And all the participants, I hope they know who you're representing. So Hasnan, I'd like you to take over.
Is it fine if I'm not able to present my thing? My presentation won't load. I guess I can just give it verbally. That's fine.
Sure.
Yeah, Hassan, you can share the presentation with us and we can share it if that's.
Then should I go after the advocate?
Oh.
Yeah, let's go with the advocate now, Hamdan. And Hassan will
Okay.
share the presentation with us. We'll share the screen for him and he'll just tell us next.
Sure. Sure. So he's an advocate of the High Court and a gold medalist with multiple certificates from international universities. He's also a vocal advocate of the Sustainable Development Goal 16, which promotes peaceful societies, access to justice, and accountable institutions. Today, he will be addressing legal safeguards against acid attacks and provisions for acid attack victims. So, Ahsan, sorry, you may start speaking and share your screen if you have a presentation.
Thank you so much for calling me here. Am I audible?
Yes.
Okay, thank you. Thank you so much for calling me here. And I do not have a presentation, but I would like to
Sure.
give you a very short brief and everything that covers the case laws and as well as the laws that are protecting the harassment as well as the acid attack survivors or the victims. So before we start, it is important to understand that how the criminal justice system works. As we all know that we are here because of the main Dr. Mahnoor's issue. She is an acid attack survivor, and what happened to her was really hurtful. And it was great to see the people speaking up for her and taking a stand, not as only being a doctor or professional, but as a female and as a part of the society. It was really great to see the people coming up and standing and talking about her, and that was really important. But that is our social aspect. The main or the important thing is how the law deals with all those people who are the perpetrators, who are the accused, or who are the convicts, or who are basically have done this thing. In Dr. Manur's case, we saw that the main accused was killed. He was extrajudicially murdered in whatever they say that it was a police attack or there was some kind of counterattack and they just killed him. Although that was an extrajudicial way of doing it. But the main and important thing is that justice must be done and it should be seen by each and every person. If he was brought to the law and the law must have sentenced him to whatever punishment he deserved, then that would have a really good example. That would have set a really good example. But obviously, it was not like that, and he was killed, and he was not brought to the law. Although, before we go into the details of harassment and as well as the acid attacks, criminal, whatever remedies available, it is important to understand that the criminal justice system works after an attack has done or after the crime has taken place. We do not have any preventive measures in law. Law does not provide prevention of any of the attacks. Law provides retribution or a kind of a social or the state vengeance for the victims. And that is important to understand because many people or the general public has a view or perception that the law or the police must have prevented certain attack or certain crime before it has even been committed. But we do forget this aspect that the police or the criminal justice system works when the crime has taken place. The police will go and get the accused arrested and then will bring to the law and then the law will take its own course and in that course the law will decide that if a person has been accused and there are cogent and reliable evidence available about his being involved in any kind of crime, then according to the law, he will be punished accordingly. So the criminal justice system takes place after or starts after the crime has been committed. Although we have two main aspects of this whole session, and that is harassment as well as the acid attacks. So firstly, we go with the acid attack thing. So what happened is that acid attacks, if we go into the international knowledge or to be try to take a really um, study a comparative study of the different countries, then we realize that acid attack is an international problem. It is not limited to Pakistan, India, Bangladesh, or any other Asian country, but rather it goes beyond into the Europe side as well as in the United Kingdoms and the United States of America, which claims the hegemony of justice and each and everything, which claims that they are the hegemony and have the best justice system in the world and put themselves on the top. So the acid attacks or these kind of violent attacks, extreme attacks against the women are available in all over the world. Now, how they deal with it, that is really important. There are two important figures in the whole of the world. One is Lakshmi Agarwal from India, and the other one is Katie Piper from UK. They both are acid attack survivors. They survived, Lakshmi Agarwal survived an acid attack in 2005, whereas Katie Piper survived an acid attack in 2008. And from then on, they became the vocal advocate of every acid attack survivor or a victim, and they provide every kind of knowledge, or you could say they are talking about a certain act. And this is the first thing when you make sure that something is addressed, you start talking about the wrong that is taking place in the society. So previously, Pakistan did not have any laws relating to the acid attacks, and that was dealt under the hurt as provided by Pakistan Penal Code in section 337, 334, 336 of the Pakistan Penal Code, where the hurts are defined, and on that basis, usually the hurt is any hurt to any part of the body. There we have two portions. One is above the head, and the other is one is above the neck, and the other is below the neck. And that was then decided that the acid has hurt any person on the arms or legs, that is appendages on the main body or on the face, and then accordingly the punishment was given to that. But in 2011, an important law was passed, and that was the prevention of crimes related to the acid attacks. What happened is that two important sections were added in the Pakistan Penal Code, that is section 336A and section 336B. That was added in 2011, and that was then again effective and effective from 2011. These sections provides you the definition as well as the punishment for all those um, perpetrators and all those accused or the persons who have done such crimes. So if we go into a short detail or a short description or a brief of the section, it states that hurt caused by corrosive substances. It is really a general section. It does not concerns or relates itself specifically to the acids. It deals with it as a corrosive substance. Law must be general so that it can cover each and every aspect for coming 100 years, and that is the important thing that is that a law can provide to a country. The way we are dealing with our laws given by the United Kingdoms, or when we were when we were a colony of the Britishers, they provided us with the Criminal Procedure Code in 1898, and since then we are following that code. We never changed that. However, India was good to change it. So 336A gives you the basic definition, and if I can read that, it is easy to understand that whoever with the intent or knowingly causes or attempts to cause hurt by means of corrosive substance or any substance which is deleterious to human body when it is swallowed, inhaled, comes into contact or received into human body or otherwise shall be said to cause hurt by corrosive substance. In law, there are four important aspects. There must be a motive, there must be an intention, there must be a guilty act, and there must be a guilty mind. So these four things are every time in every crime. There are these four main prerequisites for making that act as a crime. So the same goes for the 336A. Although the punishment it provides is really deterrent. The punishment is deterrent and as well as retributive in the nature. It provides a punishment for imprisonment of life and an imprisonment which cannot be less than 14 years. It means that this is to be dealt with by the courts of sessions, and when the person who has been accused of such act is convicted, he cannot get a lighter sentence than 14 years, along with a fine that is 1 million rupees. The fine is a deterrence as well as compoundable a monetary benefit to the victim, because we all know that any hurt that causes any hurt caused by a corrosive substance leads to a permanent disfigurement of the body wherever that acid happens, wherever that acid touches the body. So it is kind of a compound, you could say, a monetary benefit granted to the victim. Now we have to understand these two important things: that what is imprisonment for life. As we all know that imprisonment for life, as the general public understands, is imprisonment for the whole of the life until the death of the person. But that is not what law says. Law suggests, or the law says, that imprisonment for life means 25 years of imprisonment in the jail. That 25 years of imprisonment has been differently interpreted by the jurist or the judges, but the law says that it should be 25 years, no less or no more than 25 years. So the PPC is, these two sections are only related to the hurts that are caused by corrosive substances. The 336A of PPC tells us about the definition, whereas 336B of Pakistan Penal Code 1908 tells us about the punishment, and then goes the criminal procedure code that gives us a roadmap of how this case is going to be dealt. Although for non-lawyers or for the general public, that procedure could be a little difficult or could be technical, but it is better to understand so that everyone knows that what they need to do instantly if someone has suffered any acid attack. So the main and the important thing is giving an information to the police. That is the first information report, as commonly known as an FIR. That is really, really important. And it is no need that the victim must go and himself lodge a report. Any person around the victim can go and lodge the report, because it only tells the police that a certain crime at a certain place at a certain time has been committed, and the police must lodge the report against any accused, known or unknown, and start their investigation and bring in the person who has done such thing before the law. So it is important for the general public to know that the FIR can be lodged by any person, and anyone who is around must first run to the police and lodges the FIR. Once the FIR is lodged, then the police has to do their investigation, and an IO is appointed for the purposes, and then he takes the lead and do all the investigation and makes up a challan and try to find out the person or the accused who have done such act. Usually in such cases, as we have seen, the accused is very well known to the victim, as Dr. Saqib has really clearly and very you could say very prominently told us that what are the motives behind these acid attacks. And he was very right, as being a psychiatrist, as he told us in his presentation, that this is what happens usually because of rejection, or usually because of any kind of thing that triggers the other person, who considers himself to be superior to the other person. Now, acid attacks against women is common. It is not like that usually male suffers from an acid attack. It is always, or I would say 95 or 99%, it is always a female. But it is not only limited to females. We have to consider this thing, that it is not about male or female. It is about the person who has done the wrong, whether he was male or female, and it is about the victim. It is never about male or female. If you are going to go into this diversion or into this division, that the perpetrator is a male and the victim is a female, then it is going to create a rift in the society that cannot be dealt by any law. It is always the perpetrator and it is always the victim, whoever it is, male or female. So this was all about the legal aspect of the corrosive substances or acid attacks, and I'm not going into the motives because Dr. Saqib has very clearly explained all those. We have to move forward towards, as the time is also really short, about the harassment as well. I just want to tell you simply about harassment and how the law deals with harassment. Now, the harassment laws. There was this law that is in 2011, a law was passed along with this acid attack law, that is prevention of harassment against women at workplace. Now, this is a law that has been enacted, and that is enforced in Pakistan and all over the Pakistan, and everyone should be aware of this law. That whenever what happens is that a workplace harassment. Now, it is important to understand that what constitutes a workplace harassment, and how to understand that whether the certain X falls into workplace harassment or not. And for that, we have our laws, that is prevention of harassment against women at workplace. In its section, in its section 11, it says about harassment. It gives the definition of harassment, and it is a really brief, or I would say a detailed explanation that needs to be heard. And if anyone wants to understand or read it more in detail, they can just find out the law by giving it in Google. It is available on Google as well. Harassment means any unwelcome sexual advance, request for sexual favor, stalking or cyber stalking, or other verbal, visual, or written communication or physical conduct of a sexual nature or sexually demeaning attitudes, including any gesture or expression conveying derogatory connotation, causing interference with work performance, or creating an intimidating, hostile, or offensive work environment, or the attempt to punish the complainant for refusal to comply to such a request or is made a condition for employment. Or, along with that, another aspect of this harassment definition was introduced, which says that discrimination on basis of gender, that is also harassment, that also falls in the ambit of harassment, which may or may not be sexual in nature, but which may embody discriminatory and prejudicial mindset or notion, resulting in discriminatory behavior on basis of gender against the complainant. Now, this law is very clear. Although this law is not utilized, it is not a complainant does not know that I have this law and I can just go and file a complaint before the committee of the specific workplace environment, whatever place he or she is working. Again, the workplace harassment, the law suggests that it is for women. Basically, it was made for women, but it does not specify that the complainant must be a woman. It could be a male as well. So again, the harassment and their definition is given in this. Along with that, there is the abuse of authority and creating a hostile environment. Now, these two terms are really important. Creating a hostile environment and abuse of authority. This is what covers up each and everything relating to harassment. Harassment does not happen like out of nowhere. Usually we see in crowded places or in the bazaars or in any other places this thing happens. But I'm talking about workplace. In workplace, there is always a hostile environment, or there is kind of an unwelcoming gestures, or you could say an abuse of the authority. It is an abuse of the authority. Usually, the seniors who have any kind of power over the juniors in way of their transfers, their promotions, their way of making or giving them a good spot or a good space, they try to take or abuse the authority they have been vested in. So that authority cannot be exercised in a colorful manner. That authority, if exercised wrongfully, constitutes an offense, and that is again an offense and which can be complained against. Now, what's the procedure for that? The law, as I have told you about the prevention of harassment against women in the workplace, gives us two remedies. One of the remedy is that according to law, in every department or in every such a circle of the society, there must be a committee that specifically should deal with the harassment matters. And any person who has been harassed will go and complain against such matter to such committee. And if that committee, as we all know, the practical aspects, if I'm being practical and I tell you about the society, usually these people do not even care about the elders, we could say, of our society or the people in power have a very different interpretation or aspect of harassment in their mind, and there's certain acts which considers or which is a harassment for a junior, they consider it to be not even a harassment, they just consider it to be fun for them. So they do not usually take care about these things. They are like, it's fine, it's really fine, he's elder and you do not have to worry, I'll talk to him and this and that. Although that is not the way. A formal complaint has to be filed, and that complaint must be dealt accordingly by that committee. Now, we have another procedure. If that committee is not listening to you, then what will you do? Law is very good. Law gives you procedures. Law gives you each and every remedy and right. But you should have to know that. You should never think that law is not going to give me my remedy. There is always a remedy in the law. You just need to find it. If that committee does not helps you out, you can go to the ombudsperson. In every province, there is an ombudsperson. Ombudsperson is at a provincial level, and under that ombudsperson, offices are established in major cities. Now, that is a loophole on the government part because it is not really necessary that the harassment is going to take place in a major city and not in a minor city. So, a person living in a minor city, it is not pragmatic or practical for him to move all the way from one city to another and travel 110 kilometers to file a complaint and then take a follow-up on each and every hearing. So that is a loophole on the part of the government, but still what they have provided us, we can at least utilize that. On provincial level, you have different offices. In Peshawar, there is an office in the Benevolent Fund building where you can lodge your complaint, and According to that complaint, the ombudsperson will then call the accused or the person who has been complained against and will ask him that why you have done so and everything. And then the ombudsperson, now again a question that everything happened, the complaint has been lodged, the evidence has been taken, and the person has been found guilty. Now what will happen? Now the ombudsperson has two kinds of punishments to be given to the accused or the convict at that time. That is minor penalties and major penalties. The minor penalties are usually a censure, admonitions that you give to the other person that do not do this thing again, or otherwise I will be taking strict steps against you. But along with that, if that person is a government employee, his promotion can be stopped. Now, this is for the general public to know that if you want to take it seriously, and you should take it seriously, then what you can do, you can ask the ombudsperson so that the person's promotion is stopped. He is reduced in his grade. He has been sent to a lower grade, or he can be removed from the services. And along with that, he can be fined as well with whatever compensation. If that is a compoundable offense, then he has to submit a fine. So these are the major, the minor and the major penalties that are given. And this is how we say that the law is deterrent as well as retributive in nature. Law takes the revenge, but obviously the procedure is little difficult, or you would say it takes time for that procedure to be complied, because there is a single ombudsperson and he has 1,000 complaints, so he can listen to 20 or 30 complaints on each and every day, and then the proceedings are adjourned. Obviously, it takes time, but the law has provided you all these remedies. So these are the two laws. One is the Pakistan Penal Code that is done through an FIR, and the other one that is for acid attack survivors and the victims. And the other one for the protection of the women from harassment at the workplace. This is the law of 2011, and according to that, there is a separate procedure provided to them. And according to them, not only to females but as well as males, that they can complain, and they do that. And again, an important thing: if that harassment complaint goes unheard, even by the ombudsperson, then you can move forward to the civil courts, where you can file civil suit against the person. Usually people are afraid of the civil suits and civil courts, but that is nothing to be afraid of. If you want to take your right, then you have to be strong enough to come and ask for it. So this is all about the legal protection available in Pakistan. And I have also told you about, although there are other countries who are providing a better legal remedies, but as we are living in Pakistan, so we should know that what Pakistan is providing us. So these are the two laws available in Pakistan that protects the acid attack survivors and victims, deterring the perpetrators as well as taking the revenge. That is important to understand, that the law is going to take your revenge. Law is going to take your vengeance, but obviously it takes time. And the complaint procedure is provided by the Ombudsperson and the Workplace Harassment Act. So this is all, and any other questions as told that will be taken later on. So this is all about the legal protection. Thank you.
Thanks a lot, Ahsan, for walking us through the legal framework surrounding acid attacks and the provisions available to victims in the Pakistani law. And I'd like to mention that as doctors, we rarely get exposure to the legal side of things, and this is a perspective we truly needed to hear. So once again, thanks a lot. Hasnan, I'd like you to take over and start presenting.
Okay. So I am Mohammed Hassan Kareem, a second-year KMC student at Khyber Medical College, Peshawar, and a member of the Standing Committee on Medical Education in the International Federation of Medical Students Association. So basically what our Standing Committee is like the wing of the IFMSA that's focused on medical education and delivering students like extracurriculars that are focused on their medical, or that are related to their medical curricula. So what my topic is going to be much shorter than Dr. Saqib and the lawyer that we had with us. My topic is only going to be short. It's going to be the first aid response in case of an acid attack and how to deal with attendees and patients to avoid these types of attacks in the first place. So this is a Instagram post that was made by the SCOME national team, IFMSA Pakistan, and it is what to do and what not to do in case of an acid attack. This was made very rapidly after the case I'm proud of my team for being able to make this in such short notice. So the first thing is the 3 steps of first aid in terms of in case of an acid attack. So first thing you guys want to do is immediately report this incident. Call the emergency services 1122 and clearly mention the age and gender of the victims and your location. So obviously the location is most likely, or in the case that happened, it's going to be a hospital. So you call 1122, you tell them what happened. It doesn't matter if you were involved or if you are a bystander. The best emergency services as fast as possible. So victim, you would first want to remove all contaminated jewelry or clothing. You would if you guys have watched the video, one thing that we saw is that the bystander tried pulling the white coat over the doctor's face to try and wipe off the acid. But that isn't a good idea. Obviously, that person was uninformed and he didn't know better, so he tried doing the best to his ability. But what we should know is that avoid pulling clothing over the head if it risks spreading the acid to the face and the eyes, right? So what you would usually do is wiping the acid away isn't going to do much, but the chances are is that you're going to spread it to other areas or other contact with the acid yet. So the best thing is to use scissors to cut off the clothing, and if the clothing is stuck to the skin, do not force it, leave it, because otherwise you might rip the skin off along with the clothing. The third and final step is to rinse. Use a large amount of water to rinse the acid. Water is the best choice rather than any other. Water bottles wouldn't be enough. Prefer pipes or buckets. Yeah, water bottles don't have enough water to be able to rinse the acid off, and would just be to hop into the shower under a sink, because you need a lot of time underwater, at least 20 minutes. Or after that, just ensuring safety at the scene. These are other things that we could do beyond first aid, right? So do not become a secondary. He got acid on himself as well. We want to avoid that happening. These are protected hand, sharp downward motions. So if it wasn't a liquid, if it was a dry, actually brush it off instead of just leaving it on the face or using water. We would try to brush it off first. Place contaminated items away from the victim. So anything that had contact with the chemical, we have to get it far away from the victim. Do not let the victim touch their injuries, especially the eyes. Any contact, we have to avoid it. So beyond that, prioritize the eyes, face, and airway in rinsing. Those are the most important things to rinse. Tilt the head to let the water run off or away from affected areas. We don't want that water to touch anywhere else on the body, so we want to position the body in a way so that the water hits the body or the face or wherever the acid hit and falls off and does not touch other parts of the patient. So for the eyes, hold open if possible and rinse from the inner to outer corner away from the good eye. So what we would want to do is from the inside of the eye, if you guys can see, towards the outside. And if it only hit one eye, you would tilt the face away so that the water goes from one end of the eye, from the inside end of the eye to the outside, and it does not come in contact with the other eye. So lastly, we would keep moving the victim if needed so they don't lie in contaminated runoff. We don't want them touching the acid again. And keep the victim calm, sitting / lying. Responsiveness would be ready for CPR if needed. This patient is going to be in a state of panic. They just got attacked in a very vicious way. So we want to make sure that the patient knows that there is help around them and that they should stay calm to the best of their ability. So now what not to do. These are common things that people do, which are misconceptions and that should be avoided. Do not try covering the brain right away. It'll trap the acid and it'll make the attack more violent. Do not use creams, ointments, milk, or neutralizing agents or alkali or other substances. So basically the best thing to use is water and nothing else, because neutralizing reactions reaction in contact with these substances will produce more heat and burning actually. Do not apply any home remedies, just use what the doctors give. Do not chemical, and do not delay. So we don't delay the rinsing, but we only rinse with water. So for the second topic, about just behavioral, what we as doctors can do to avoid these types of circumstances in the first place.
I think Hassan is facing some internet issues. So he shared the presentation with me, and I just read it out. That's what we can do. I think 2 slides were left. I'll share the slides, and then let's see what we can do. So just give me 2 minutes, everyone.
Hello, am I audible?
Yes, then you're audible, and your screen isn't shared. So could you share that again?
Okay, I'll just share that again. Could you please let me know since like when my mic went muted?
It's fine. Just the last minute we couldn't hear properly.
Okay.
Just continue from wherever you were.
Okay. So I think I don't know since when I got muted, but I guess it was probably the third or the fourth last point. So as I was saying, if a situation escalates, call security or law enforcement. Basically, decouple yourself from the situation as soon as possible. Don't try to escalate or don't argue with attendees. That's one of the worst things that we could do. Don't end up alone anywhere. So make sure to have bystanders and to be in like a more public area so that nothing happens to you by yourself. And lastly, it's just a quick recap. Prioritize your safety, secure the scene first, protect yourself and the victim in case of the acid attack if you are not the victim. Also, make sure that you're respectful, treat attendees with dignity, and establish clear boundaries so that these things don't happen in the first place, and de-escalate respectfully if there is a conflict. So stay calm, listen, and keep distance, and call security if needed. And I know it's not the best thing to hear when we're as doctors to be lectured ourselves on what we should do behaviorally, but I think it is most important to understand that in these types of scenarios, you cannot control the other person, but you can control yourself, and you can control the outcome that way. That's the end of my presentation. Thank you.
Thank you, Asnan, for walking us through the first aid response to acid attacks and how to handle these situations with calm and sensitivity. I believe this is practical knowledge that we will generally carry forward with us as doctors, as future doctors. And now for the Q&A session, if anyone wants to ask any question from our Advocate Ahsan Khan, Dr. Saqib, or Asnan, they may unmute themselves and ask their questions.
If you guys do not have any immediate questions, so we have a list of questions and we can ask from that as well. So we'll give you guys a minute to take your time. Hamdan Zainab has raised her hand.
Zainab Rahman Marukh, you can unmute yourself.
Am I audible?
Yes.
You guys have brought up thank you so much for that. Well, the next question from Edward, that how being a student, I feel like as I myself am a first year student, hopefully we won't encounter such things in our early years, inshallah. But what if we see someone suffering? So how do we you named some authorities that we can go to, but don't you think that sort of confidence issues, and how are we going to make a complaint? Who will going to listen to us? How should we encourage ourselves to go to those authorities, and where exactly can we find these? I am from Lahore, so in Lahore, Islamabad, or major cities. Can you explain that first?
Thank you so much, Zainab. Am I audible?
Yes.
Okay. So basically, you talked about that. How do we gain confidence, or how do we go to the authorities? Also, that gaining confidence part is can be best answered by Dr. Saqib. He's a good psychiatrist, and he can better tell you about gaining confidence. But also, there is one legal answer to your question is that there is no necessity for you yourself being a victim of, not talking about you, any other person being a victim should herself or himself go to any such authority. Any other person, whether a family member or any other friend or colleague or any bypasser or any standing by person can go to the authority. Who is the authority? If you are from Lahore, in Lahore, the CM has done many improvements, and I would say it's quite better than KP, as Punjab is dealing with these things with the iron fist. Firstly, you have to make sure that you lodge an FIR about the acid attack victim. Even if you encounter any other person suffering through that, you can just go to the police, the nearby police station, whatever area it is. You can just Google it out and find out that I am in this area, in which police station does I fall. So that Google will give you your specific police station. You can go to the police station straight away. There will be a person sitting inside. You just have to ask the person standing on the gate that I want to lodge an FIR and this thing has happened. They will lead you to the person, usually called as Muharrar of the police station. He will write down your FIR. Now there is an important practical lacuna, or you could say an issue with the police system in our Pakistan that persists from KP to Balochistan to Punjab and Sindh. They do not immediately take your FIR. But what you have to do is that you have to make sure that they reduce your report into writing form. Just make sure that they reduce your report into writing form, whether it is a simple paper or whatever it is. Once that report is reduced into writing, then they will go and find out that such thing has happened or not, and the person named is actually the accused or actually the person who has done so or not. So what they do is that they take your report on a simple paper, they take a team and they go to the specific place and ask the people around that something happened. They take the CCTV footages, they try to find out the person. If they can find it out, they just lodge an FIR. So it is important that your complaint is in written form so that later on, if you have to take any further legal steps, or you become the search victim becomes a victim once again of the police police gardi. We call it police gardi, but that basically is that the high-handedness of the police, that they do not take your report, and because of the other person who is the perpetrator, they have some good connections, and they do what they do is that वो आपको रोक देते हैं, वो पुलिस को रोक देते हैं कि एफआईआर ना लॉन्च की जाए, और आफ्टर considerable delay they lodge the FIR. So you make sure that वहाँ भी हो जाए. As far as your confidence part is concerned, so for me, being a lawyer, I would say that you have to do it. If you do not take a stand for others, you cannot take a stand for yourself. And if you do not take a stand for yourself, you cannot take a stand for others. So it is important, because whenever we go and plead a case, we consider ourselves to be in the position of the client. So then and only then I'm able to talk before the judge and convey what the client is going through. And I would say that Dr. Saqib would be better able to tell you that how you can regain your confidence or to muster up the courage to go to the police. But for me, you should run to the police and make sure that your complaint is registered. This is all.
The advocate and sir, they gave a very technical answer. लेकिन मैं एक general बात करूँगा, और ये in general for everyone over here. Because what I understood from the question was कि हम क्या कर सकते हैं if we see such people who face such trauma. So being a first year medical student or second year फिर third year medical student, so obviously हमारे साथ limitations हैं. एक तो we do not know the exact know-how कि legal system में हमें क्या करना है, and then secondly there are बहुत सारे रुकावट होते हैं, जिस तरह the Ahsan said कि police के affiliations होते हैं with the other party, या फिर they have their this arrogance or whatever, and obviously it is a difficult thing. So that does not mean that we should not try. So what we can do is what we're doing here right now. हम भी medical students हैं, all of us are in first year, second year, third year, or fourth year, and what we're doing is we're spreading awareness. So that's what my answer is. The least you guys can do is to spread awareness about such things. और क्योंकि हमें फिजिकली कोई जितना भी रोके हमारा जुबान तो फिर भी काम कर सकता है. एंड सोशल मीडिया का ज़माना है. वी हैव इंस्टाग्राम, व्हाट्सएप ग्रुप्स वगैरह सारे हैं, स्टूडेंट सोसाइटीज़ हैं. हम ही यूथ हैं इस पाकिस्तान का, हम ही फ्यूचर हैं. एंड वी शुड हैव दिस सेंस ऑफ रिस्पॉन्सिबिलिटी इन अस कि अगर हम नहीं करेंगे तो और कौन करेगा. तो इट वाज अ गुड क्वेश्चन कि लाइक अगर प्रैक्टिकली ये चीज़ हो जाए, मैं एग्जैक्टली इसको कैसे टैकल करूँ. तो शायद मैं इसको एग्जैक्टली टैकल नहीं कर सकता. शायद मुझे ना पता हो कि मैं किस जगह पे जाके किस तरह FIR या वो सारा कुछ करूँ. हो इफ़ आई spread awareness about this enough, if let's say I reach my message reaches 1,000 people and one out of those 1,000 people is able to do that technical thing that I'm not able to do, so at the end मकसद तो पूरा हो जाएगा. So that's the thing I would like to add. जितने भी participants हैं, there are about 40 or 30 people in this group. All of you just take this one point home, that we should use our voice to for these downtrodden people. We should be a mouthpiece for the downtrodden. Hamdan, you can continue with the questions.
Yeah.
Acha. If anyone has any questions, they may raise their hand and I'll stop. Filhal, I'll narrate the questions I received from the evaluation forms. So the first question we have is, what evidence should healthcare professionals collect after an incident to strengthen a legal case of workplace harassment?
The healthcare professional, the first thing is that you must, because the police will come late, make sure that the crime scene is all cleared from the people. You must first secure the crime scene. Securing a crime scene is not that you have to just turn that tape around that crime scene, but just make sure that no one tries to take away or wash away any evidence. Because usually this happens that whenever a crime happens, the perpetrators usually fled the scene, usually flee from the scene, and they do not come back. But the people around, because of their willingness to help the victim, they unknowingly or unconsciously destroy the material evidence. Now, as for today's consent, the first thing is the CCTV footage. Make sure that if any place that is covered by cameras and any such incident happens, first go and secure the CCTV footage. Take a copy of that footage in your mobile phone or take in any other place, but make sure that that CCTV footage is totally secured. Secondly, on the crime scene, the victim goes, we have very important things. The hurt of the victim that will be examined by a doctor, obviously by you people. There are many medical legal officers that are usually appointed in the hospitals, in the emergency centers, and the police as well. And when you take a victim there, the specific medical officer or the doctor will come. That doctor must make sure that whenever he or she is writing the medical report, she must be very careful in writing the medical report, because I have seen multiple acquittals because the doctor did not write the report rightly. What they do is that you have to make sure that you clearly narrates the condition of the patient. Now, acid attack victims are traumatized, but they are able to speak. They can narrate what happened to them if they are not burned on the face or any such thing. If their mouth is working, what happens that doctor just write that the person was not in a good condition, and the report is then filed by the specific victim, and then the people or the police exploit this thing. The lawyers exploit this thing that if the victim was not in the condition to speak, then how the report was narrated by such victim. So for the healthcare professional, first thing is the CCTV footage. Second is that whenever a victim comes to the hospital, the medical legal report must be written properly. The time must be mentioned properly. The condition of the victim, and as well as the injuries that victim has suffered, that must be specifically marked. And make sure that whenever you are writing any jargon, any technical term that is a medical jargon, you make sure that you just try to explain it a little for the general public, because the police officer or lawyer is not a doctor. Just the way, if I'm talking in any technical jargon or legal jargon, you people will not understand what is meant by locus standi or what is meant by mens rea or actus reus. In the same way, we do not understand that what is meant by asphyxia or what is meant by any other medical jargon. So you make sure that you slightly in one sentence just explain that what it means. Usually, the doctors write that the patient came and he was in gasping condition. He was gasping. They just write the word gasping because they have to explain it to their doctors, the seniors. And then the same victim is giving up the report. And then the lawyers exploit in the way that if that victim was gasping and how he was able to talk. So you have to make sure that when a victim comes, what was his condition? And then when after 20 minutes or 30 minutes he was fine, or when he was narrating the report, what was his condition? So the medical report is really important. The hurts on the body of the person, the clothes, specifically the clothes that he or she is wearing, make sure that if you can secure that, that is really important. That goes with the evidence. The CCTV footage and the statement of the witness. Make sure that all those people who are usually present on the spot, like if it is a hospital, the doctors or the hospital staff, they should give up a statement, not any other patient or any such person, because the patient is not going to come again for your statement in the court. They are not going to come for you again. That is a practical thing. At that moment, everyone will be willing to do whatever they want. But after 1 year, and when they have to go through such long procedure, no one is willing to come forward. So make sure that the doctor or the regular staff is there to help you out. So these are 4 or 5 important evidence that must be secured whenever such incident happens, specifically talking about the acid attacks. And as per the harassment is concerned, so the statement of the victim is far more than enough. That has to be corroborated or substantiated by if any evidence available, any person around you, if he or she has seen such thing, or any CCTV footage around. So that is enough for the harassment thing. This is my answer to the question.
Thanks, Ahsan. अच्छा, अगर किसी को कोई और क्वेश्चन पूछना है, now is the time, because I'll be narrating one last question and then we'll end the session with a group photo and closing remarks. Asha, so I think Dr. Saqib will be better able to answer this question. And the question is, what are the early signs that workplace stress has progressed to burnout or trauma?
So the early person will be socially withdrawn. So most of the people confuse socially withdrawn people with the introversion. If the person is introvert, I have been an introvert. A lot of people here will be a personality of introvert people, but it doesn't mean that they are socially. इसका ये मतलब ये कि I am socially withdrawn. मैं function करता हूँ, मैं hospital जाता हूँ, अपनी duty करता हूँ, अपने peers के साथ, अपने colleagues के साथ, अपने family के साथ इंटरेक्ट करता हूँ. सो ये साइंस सबसे पहले आपने सोशली विड्रॉन देखना है कि वो सोशली विड्रॉन तो नहीं हो रहा, मॉल एडप्टिव बिहेवियर तो नहीं है उसके स्लीप की कोई डिस्टर्बेंस तो नहीं आ रही, उसकी कंसंट्रेशन की कोई प्रॉब्लम्स तो नहीं आ रही, उसके इमोशनली कोई प्रॉब्लम्स तो नहीं आ रही. फॉर एग्जांपल एंजाइटी तो वो डेवलप नहीं कर रहा, ट्रू थॉट्स तो उसको नहीं आ रहे. यू हैव टू बिल्ड अ सपोर्टिव एनवायरनमेंट. रेड फ्लैग्स ये हैं कि आपको साइंस दिखे डिस्ट्रेस के, जिसमें रिपीटेड, जिस तरह मैंने कहा कि एक पर्सन अगर एक ट्रॉमा से गुजरता है या इवन वर्बल किसी कमेंट से गुजरता है एक वार्ड में या डिपार्टमेंट में, तो वहाँ जाना पसंद नहीं करेगा, वो अवॉइड करेगा. सो ट्राई टू टॉक पर्सन, हमेशा बात कर, वो है बार बार वो बिहेवियर शो कर रहा है तो वो अवॉइडेंस एब्सेंटिज्म है, वो छुट्टियां करने लगेगा, वो नहीं आएगा मंडेज को, वो नहीं है ट्यूसडे जरूर पाएंगे लेकिन मंडेज को वो नहीं आएगा क्योंकि वो इंट्रूसिव प्रोसेस को सुनेंगे. दीज आर द सम ऑफ द रेड फ्लैग साइंस. फ्लाइट और फाइट मोड में वो हमेशा होगा. अगर उसकी सिम्टम्स करना चाहते हैं तो वो आपको रिपोर्ट ही करेगा, स्वेट करेगा, प्रेडिक्शंस होंगी, उसको बात नर्वस होंगे. So these are some of the red flag signs that you should note in your colleagues if they are suffering from any kind of trauma, whether it's verbal, non-verbal, it doesn't matter. Trauma or harassment is a problem in our country. We are discussing today's our country problem, so we will stick with that. So these are some of the red flag signs. Again, I would add to Ali remarks on that कि मैं नहीं करूँगा तो कौन करेगा, वो बात उसकी बिल्कुल ठीक है. अपार्ट फ्रॉम जो हमारे डिफरेंसेस हैं, अगर हम सिर्फ एक मेडिकल कॉलेज की बात करें तो उसमें सोसाइटीज आप देख लें, स्पेसिफिकली पॉलिटिकल सोसाइटीज देख लें, तो इतने हिस्सों में बढ़ चुके हैं कि एक स्टूडेंट दूसरे स्टूडेंट की प्रॉब्लम सुनने को तैयार ही है. कॉमन कॉज नहीं है किसी के पास. अब ये कॉमन कॉज है, इस पे सबको आवाज उठानी चाहिए, सबको बात करनी चाहिए. किसी स्टूडेंट के साथ ज्यादती हो रही है, उस पर आप नहीं आवाज उठाएंगे तो कौन उठाएगा. इसमें परवरिश का रोल भी है, क्योंकि आजकल जो पेरेंट्स हैं, मुझे इस तरह लगता है, ये मेरा पर्सनल ओपिनियन, you ये नहीं आप इसलिए नहीं कर सकते आप पेरेंट्स हमें आजकल के स्पेसिफिकली आई थिंक केवल तुम अपना काम करो सो एक रोजाना बनाया जाता है दास्ता प्रॉब्लम न दे ये आपकी प्रॉब्लम नहीं है छोड़ दो आप क्यों इनकलाबी बनना चाह रहे हैं आप क्यों प्रॉब्लम में पढ़ना चाह रहे हैं आपके पेपर फेल होंगे वो उसको कुछ नहीं होगा सो फॉर अ गुड सोसाइटी यू हैव टू रेज योर वॉइस अपार्ट फ्रॉम कॉन्सिक्वेंसेज अगर आपने देखना शुरू कर दिए बिलीव मी आप रिग्रेट में और गिल्ट में जी रहे होंगे और सारी उम्र जब आप रिटायर होंगे तो यही सोच रहे होंगे कि मैंने जिंदगी कैसे गुजारी है
Thank you, sir. Acha, for the end, this is a cultural thing और ये हमारे सोशल वेलफेयर सोसाइटी और IFMSA के जो भी सेशंस होते हैं we end our sessions with a group photo. So I'd really appreciate you all if you could turn on a camera and we could take a group photo, and then with the closing remarks we would put an end to this session.
Wait for a minute, Hamdan, and if anyone else has to, get ready for turning on the camera. It's a thing that we wait. So you guys can take your time.
Sure.
Yeah, we'll wait for a minute and then we'll take our picture.
Sir, if we have a minute or two, can I add to my question? Like,
Yes, sure, you can. Is your question directed towards the advocate or Sir Saqib?
actually, I'm not that sure because there was a situation like usually I travel back to home on bus, so I hear house officers like gossiping about some situation which are like literally harassment scenes, but that just stays till the gossip thing. वो गॉसिप बन के रह जाती है उसको आगे लाइक वो ना टैकल करते हैं ना कोई इनकाउंटर करता है क्योंकि जो इनकाउंटर करने की कोशिश कर रहा होता है वो फ्लैशबैक्स फेस कर रहा होता है एंड सेकेंड एग्जाम्पल लाइक अभी हमारे यूनिवर्सिटी का लाइक ट्रिप गया था जो स्टूडेंट्स का प्राइवेट होता है तो वहां पर एक बस का लाइक 4 कोस्टर्स थी उनमें से एक बस का कंडक्टर था और वो लाइक उससे लड़कियां हरासमेंट वाली चीजें फील कर रही थी तो ग्रुप में एक मैसेज शेयर हुआ था कि कोई उसके साथ अकेले ना हो मेक श्योर करो और जब जहां आगे पीछे जाओ तो 3-4 लड़कियां साथ जाओ तो लाइक ये अवेयरनेस के तौर पे बस एक मैसेज शेयर हुआ था क्या इससे ज्यादा उस पर कुछ करना चाहिए था नहीं करना चाहिए था या इतना काफी था या उसमें हमें और बेहतर क्या कर सकते थे हम उस सिचुएशन में या गॉसिप वाली चीज को हम कहाँ तक लेके जाना चाहिए वो अभी क्लियर हो सके
Ahsan, would you like to answer?
Sure, why not? So basically, you're talking about a situation that happened when you were going for a trip, and usually this thing happens. This is really common, and many females do suffer from this thing, and they do face these things. And as you said that there was a gossip and there was a talk, although as your question suggests, that is कि जहाँ females थी उनको ऐसी vibes आ रही थी, but they did not encounter any such act. Now here the legal thing takes place, and apart from legal, I will also talk about the social aspect as well. That until and unless an act is not done, you cannot accuse someone of doing certain act. ठीक है एक vibe आना if you are feeling it that he is staring or his behavior is that of harassment. So I would say that it was for more than enough that everyone is taking caution and care because this is life. You have to take caution and care about your own self and about the people around you. And that was a great thing to know that the females in the group were talking constantly to each other and they were telling each other that you have to be aware of such and such person. So until and unless there is no such act from the other person, then you do not need to take any further step. Obviously, if there was any kind of a certain act that could have been directed towards any female, then it would have been better that you put him to take him to a police station. But if there was no such act and it was only a vibe, or if there was only a feeling from his behavior, So you have to understand this thing as well, that many people come from different backgrounds. For them, maybe it was not an act of harassment, but rather their way of carrying themselves. Because until and unless many students who comes from different backgrounds in their initial years do not know how to conduct or carry themselves around the girls or around the people in the university, but after a year or two of education, you would see that they become the best of their selves. So it is all about education, everything. So a bus conductor, he came from a different background. For him, maybe it was a new thing, or maybe he had something in his mind, but he didn't do anything. So it was better to take the care and caution. That is about your trips thing answer. And the other thing that you were on a bus and the HOs were talking about that certain harassment has taken place. So for them, it was good if they have taken up that that thing to the authorities. Now, why this? There is this Young Doctors Association, YDA, and there are other associations about the lawyers as well, and as well as the doctors. These associations are basically the pressure groups who deals with these authorities. That if these authorities are not doing their work properly, so these pressure groups, in a really positive way, deals with such situations. So it was good if those HOs would have taken it to their union if they have any. If they do not have, then be the first person and make up a union. Go and make up a union, just add them in a big group and start acting as their leader and tell them that this thing has happened. We have to raise a voice together. So this is really important if you are raising your voice against such thing. And so I would say that about the issues, they should have taken that matter to the authorities. If they haven't done that, then that was wrong. And about your bus incident, so I would say that it was far more than enough.
Acha, thanks, Hassan. So, do you have anything to say, Zainab?
No, I was just thanking. Thank you, sir.
Acha. Acha, as for the group photo, we shot on time, so I really appreciate if every one of you turns on the cameras and we can have a quick group photo session, and then you guys can leave.
I think everyone has had enough time to prepare themselves for the camera. To agar or कोई नहीं लगा रहा, तो that's it for this meeting. So I think we should take the picture now.
Once you take the picture, Khalid bhai, let me know.
Okay, so I'll be taking it in 3, 2, 1. Hasnan, you guys at IFMSA, I think you guys have a culture of doing something like this. I don't know, it's called Scopy hugs or something. So Saqib, Ahsan, and Hamdan, all of us, we'll do like this and then we'll take a picture. See that? It's just a symbolic.
What do you
thing.
do?
Okay, so 3, 2, 1. Perfect. Thank you so much. Hamdan, would you like to?
So with that, we bring today's session to a close. Sincere thank you to our speakers, Hasnan, Dr. Saqib Naseer, Advocate Ahsan Khan, for giving their time and sharing perspectives that we as future healthcare professionals generally needed to hear. And to our participants too, thank you for being present and engaging with the subject that really matters. Thank you all, and I hope we all had something to learn and that we'll carry around as future medical professionals.